Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Kourtney Sharafsaleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media.
Hi.
Hi.
You're on. Okay. So you're in the closet?
I am. Does it sound okay?
Sounds great. It sounds
I'll come
good.
out of the closet when I'm done.
Hello. Welcome to the Geri Academy podcast with your host, Dr. Kourtney Sharafsaleh. And this is episode number 4. So today I have a very special guest, Dr. Kourtney Kemp. She is a surgeon and a beloved friend, one of the first people that I met in medical school. Actually, she is the first person that I met in medical school. So, Dr. Kemp, welcome.
Thank you. Thank you, Dr. Sharafsaleh. I'm happy to be here, and thank you for all that you're doing with Geri Academy.
Well, thank you so much for contributing, because I don't think I could have contributed to your blogs the way that you did, but I think the information is so important. So you wrote 2 blogs. The first one is called The Surgical Road Trip, and then the second one is called Getting Optimized for Surgery, Preparing Your Vehicle. And so for anyone who's interested, check those out on the geriacademy.com website. And what I want to ask is, tell us a little bit about yourself.
So I'm a general surgeon in Minneapolis, and I do basically general surgery. I explain it to my kids as anything from the chin to the knees, but no bones and joints. So mostly abdominal surgery, but anything from age 5 to is experienced as you can imagine. So the most experienced person I've operated on is 102 years old.
Oh, wow. That's a pretty young old man.
Yes.
And why did you think this topic was so important?
Well, I think there's a lot of questions around surgery, and especially some of my experienced older individuals. That's kind of their biggest question, especially coming into my office and debating on whether or not they should do their hernia or not do their hernia. And we get to have a long, in-depth discussion about it. But I often see a lot of emergent, urgent surgeries, and there never gets to be that discussion. And that's what's kind of sad to me. It's brought on urgently. Their family's stressed. They're stressed. They don't know what to do. A lot of times they don't have a choice, or minimal choices. They have the option of thinking about dying because they're very sick, or they have the option of undergoing a frightening surgical procedure. And those are the conversations that are really hard to have because they're in distress and they're making a decision under distress. And so I try to minimize that. I'd really like to know every one of my patients before that happens, but we don't always have the luxury of doing that.
And do you sometimes find in these urgent, like emergent cases, that patients didn't prepare, like didn't have advanced directives letting their loved ones know whether they wanted a procedure done or not?
Yeah, most people haven't had those discussions. And I think you just imagine that you're dealing with everything in life, your grandkids, you're painting a wall. There's so many things that are going on in your household that nobody stops to think of, okay, well, what if I have to have a surgery? What if I need to have a medical procedure? What have I prepared? And so a lot of times they prepare for lots of things, going to the grocery store, making a list, going on a road trip. And so that's what I wanted to kind of move towards. What is it like to go on a road trip, and how do you prepare for that? So maybe individuals, before they get to that point, they've gone through these scenarios and talked it with family. So there's less guilt, less scariness associated with these decisions for people.
Where do you think the best place is to start maybe having some discussions about advanced directives?
Yeah, I think the best thing people can do is take time to sit and think and write down questions, write down the things that you're scared of, you're nervous about, kind of the what ifs. What are your worst fears? What are the things that you'd like to see for the rest of your life? And I know this is a scary question for a lot of people, but how do people prefer to die? I think about that, and I'm almost 40 years old, and I think, do I want to die right now? No, not for a really long time, but you always have to think about that. And you think about as you age, all the what ifs of how things happen. Having a parent myself that has passed in a sudden way, um, and somewhat in a non-sudden way. My mom had cancer for several years, but the way she ended her life was pretty abrupt. And even me being in the medical field, we didn't have a lot of discussions around it.
Yeah. Yeah. I think, so as a geriatrician, one of the things that we do in the hospital is advanced care planning consultation. And one of the concerns that we have is that a lot of times we're seeing patients that are completely altered, so they can't communicate with us, and their family has no idea what this person wants. And a lot of times they're like, gosh, we never talked about this. And so, maybe we could get to talk about this like over dinner. Like maybe if we make it so it's not so taboo and so terrible, and maybe like accept, right? Like death as a part of just the whole life process, and not avoid it, right? Avoid those discussions. Maybe we'll get to a place where even when we're making those decisions to have surgery, our family can really have the support that they need to give us what, our needs are or what our desires are, right?
Yeah, and I don't know the answer to this, but I'm curious to see if you have any thoughts on this. I often wonder, as we get older, there's so much life experience that goes on that I wonder if there's a sense of protection still with your adult children in having kind of these deep, difficult conversations. And I don't know how much of that plays into, but I imagine if I was 90 years old that I would have thought about many different scenarios, because there is a lot of time to sit and think after you retire. But I just wonder if some of those decisions and discussions don't happen with adult children for a variety of reasons, because they're still your kids. You want to protect them.
Yeah. And culturally too, I think it depends. And just like living in, Ohio when I was in residency, and then now living here in the South, when I was doing rotations in New York. And I've noticed that just there's so many differences in terms of beliefs and culture. And so that also plays such a big role in it too, like how much people are willing to go through to live, right? Or how much people really value more longevity versus quality of life. I think it just, I'm always surprised. I haven't found that like, oh, I've seen this as a geriatrician and this is the norm, because I'm always surprised. Like,
Definitely. And I think for the general population, I mean, talking about those things makes you think about that person not being there. And that's a very kind of sad realization that it brings in a lot of emotions when it's family. But if it is more of a discussion that's just like another life moment that we all encounter at some point in our life, rather than this sad moment of realization that we don't have to have those emotions quite yet, having more of a discussion of that quality of life, of what we want to see living here,
yeah.
for people.
Now with you brought up a couple of things, and sometimes like I'll walk into a room and in my mind I'm like, oh my gosh, we have to stop the madness, because as a physician, like we're trained to like do, right, to fix and do things. And sometimes we may really just be like, okay, what we want to do may actually cause more harm and not fix the situation, even though we've been trained to function in a certain way under a certain situation. And I think with surgery, and I loved when you said that. Should I really go on this journey? And then you also said you get one vehicle in your lifetime. I love that, because yeah, maybe it's not what we want, right?
Mm-hmm.
Maybe, and if it is, I think it's good to have thought about that too.
Yeah, we don't get to control the cards we're dealt. And so you get that vehicle, and I think it's very significant to kind of your life, how there's a portion of how you care for it, and there's a portion of what you have in front of you and how to best take care of it. And you have choices in it, but there is certain things that we can't control. And I think that's always difficult. And if we can give more control to the person and let them know what they can control, I think it helps. It helps even just peace of mind and making those decisions. And I think when you go into the room and you talk about surgery and people say, I often hear, well, she's 85 and she's lived this long, and she's a tough person, and reference how
Yeah.
tough she is because she's been through so much and she's 85. And the fact that she's made it to 85 signifies she's extremely tough, extremely strong. But your body is still 85. Your organs are 85. They've been through 85 years of wonderful experience. So we always have to take kind of a cautious look at that. And our bodies never last forever, and that's what's difficult with surgery is we never want to do things to people. We always want to do things for people, and we want to make sure that when we're doing something for people, we're making them functionally better, we're improving their quality of life, we're preparing them so that they know what they're getting into, so they can mentally have those choices in their care.
And so we've talked a little bit about, more urgent situations too. And maybe if I back up also, like, is the journey necessary? How do you discuss that with patients that are just coming into the office, for some more routine procedures, right? Like gallbladders or.
Yeah, I think that's the difficult one because we don't have a crystal ball. And I think there's the expectations of us physicians knowing what the right thing to do for every patient. And as a person gets older, it's harder to make that decision as a physician of what's best for them. It's easier for my 20 and 30-year-olds where the risk is really low and the reward is really high. But as our patients get older, the risk is high and the reward is much lower. So we're constantly trying to balance that. And so I think the best thing is to get to know the individual. What are they looking for? And I always try to start conversations with, what do you hope can get fixed, changed, or improved? And if they can tell me something specific that I can do something for that's realistic, we're starting on the right page. And then we start talking about the risk and all the things that can go wrong, as well as right to make them better. And how do we balance that?
Okay. Do you you also mentioned, so a patient is in your office, you said, who's going on your journey? Do you recommend that patients, like older adults, go to a consultation with a loved one, right? Either a family member, a spouse, and how can they involve that person in their decision making and then make that person more of an advocate, right? Even if the person doesn't agree with their decisions.
Absolutely. I think at any age, if you're undergoing a surgery or procedure, it's good to have somebody with you. There's so much information. Most patients will forget 50% of what we tell them in the clinic. And with surgeries or procedures, the expectation piece is huge, and having an extra set of ears are great, but also having that support to remind them they're going through a very scary thing. And whether or not they want, some people don't bring people because they don't want to burden them or they have other things to do, but this is a really big deal. And we recommend that everyone bring preferably their power of attorney or the person that will help make them decisions, but any family member or friend, frankly, that will hear what their doctor is saying and also be able to talk to them after the visit. Hey, what do you think? That kind of stimulates that conversation of, what would this happen in the healthcare? What would you want me to do? And it starts that conversation.
You had also mentioned, and I wanted to give the statistic because I thought it was so important that only 26% of people from a 2018 study had advanced directives going into major surgery. And, for an older adult, and we'll get into that for the next part, getting optimized, post-surgically, there are so many complications that if only 26% of people have advanced directives, I just can't believe the burden that could be left on their family members or loved ones to try to make a decision, like a life and death decision, if that's what we come up to, that point.
Yeah. And I would say the majority of those patients are people that have been in senior facilities or skilled nursing facilities, because they tend to focus on those advanced directives more frequently than people living independently. And I think the independent ones are the trickiest ones because they have lived such a vibrant life to that point that the idea of a major life change, like going into a nursing facility or having a sentinel event, what we call as a major life-changing event in healthcare, isn't really considered by family or friends. And the idea that family or friends have to make that decision for them is agonizing. There's a lot of guilt that comes with it because they just want them to be where they were at before. Or they want that family member to be a part of that decision when they can't be.
Yeah. And then also you mentioned disease burden too in making that decision to have surgery, right? If patients who are like diabetic or have vascular disease like heart disease or have high blood pressure, these patients may need to make different decisions than those who don't have some of these chronic diseases.
Yeah, definitely. I think the biggest ones that we worry about is the diabetes and the smoking, particularly with surgery. We're doing things to them that require them to heal, and we are putting some kind of scar or incision somewhere on their body that we need them to heal for this to be successful. And uncontrolled diabetes is a huge one, and smoking is another big one. And so if either one of those are affected, it affects every organ system, particularly our brain, our kidneys, our heart. And so any kind of insult whatsoever in that healing process could sway someone into renal failure. It could sway them into a delirium. It could sway them into heart failure. So we're very cautious with those pieces of the care. And we certainly don't want to minimize risk of infections, pneumonias, heart attacks, strokes, and all of those can be minimized if their diabetes, their high blood pressure, their vascular disease is well controlled as much as possible.
And, that kind of leads into your second blog, which is awesome. Again, titled Optimizing for Surgery, pretty much. And you start out by talking about the smoking and cleaning out your vehicle, right? And doing a maintenance check. But one of the other things that you talk about specifically is your bowels.
Yes.
So important.
Yes. And I think people underestimate that. As we get older, our colon doesn't function as normally. You get a lot of buildup of toxins and residues. And everyone over the age of 50, it is important to have regular bowel habits. If you take fiber and you're getting enough fiber, like 25 to 35 grams a day, you are helping to reduce your chance of colon cancer. And one of the theories beyond that is you are binding those toxins and residues, minimizing the total amount of exposure that colon lining is encountering. So your bowels become more regular, you move things through. But surprisingly, when patients are constipated, there's higher risk to delirium. Also, when you have chronic constipation and you add anesthesia, pain medications, it can get so severe that people get backed up, bloated, they have troubles with nutrition, eating, drinking, and it's a vicious cycle. And so I specifically mentioned bowels because so much of surgery involves those bowels and those healing.
And thank you for mentioning that, because I think, a lot of people don't think about that. So one of the reasons we see patients in the hospital is for delirium. And oftentimes it is post-surgical delirium. And one of the things we ask is, okay, when was their last bowel movement? Or, have they voided? Have they gone to the bathroom and we check to see if they have a catheter, right? So we know that they're urinating, because that's really important. And if you're not clearing your body of that, it can be very just
Yes.
uncomfortable, and you can get very confused. I mean, and you're miserable,
Mhm.
right? And you're unable to tell people like how you feel until you just feel better
Yes.
again. And we've had some patients, and I'm sure you've seen this too, like a couple of liters of urine in
Mhm.
their body that they were not able to get rid of. And then the next thing you talk about is the maintenance check. Can you go into that a little
Yeah, the
bit?
maintenance check, with any surgery, we always want their primary doctor to see them. And a lot of times with younger, healthy people, we're looking for anesthesia risks. With our older individuals, we really want to make sure their overall healthcare is optimized. And that means their blood pressure medications, um, checking to see which medications they no longer need. Many people have polypharmacy, which is basically they're on a lot of medications for a lot of reasons. And some medications might be counteracting side effects of other medications. So we really want people to just be on the essential medications. You should be working with your primary doctor to, those visits. Which ones can I get off of? Which ones are absolutely essential for my heart, my diabetes, and why am I on those? And I think that's always good to have a family member with you to go through that with you, because there is confusion that develops over time. And when you have lots of medications, medical issues to deal with, it's good to have a second set of ears to help you with that as well.
And you do talk about starting on a full tank, so
Mhm.
nutritional needs and how important it is for muscles to have enough
Yeah.
protein. Elaborate
Yeah,
on that a little.
protein is kind of the building block of healing. Your protein in your muscles, when you undergo a surgery, imagine like you're going on a marathon. You need storage. And what happens when you have a surgery is all the protein for your muscles go to that healing process. So people feel weak, fatigued. It takes a good year for anyone over the age of 65 to really get their energy level back. They might be 80% there by the 3 to 6 month mark, and then they have this kind of lingering fatigue. And the more you can build up that protein storage, either by building muscle through activity or through nutrition, protein, that's really important to helping regain your energy after surgery, but also preparing before. I would caution people with kidney issues have to be careful with too much protein. So it's always good to talk with your primary doctor about the amount of protein you can get and what kind of nutrition you should get before your surgery.
Okay. And packing efficiently. I love this part because we talk to our patients like before
Mhm.
you go to the hospital, like take your
Yes.
stuff with you, take a photo frame, make sure you have your hearing aids, make sure you have your
Yeah.
dentures. These things will help prevent you from getting delirious. But there's more to it than that. You talk
Mhm.
about pain and just the healing
Yeah.
process.
Yeah. And, you want to make sure that you're on minimal amount of narcotic pain medications. Talk with your doctor about how to manage your pain in a humane, safe way. And we really want that for patients. And then also keeping your mind sharp. That's really part of the healing process, and bringing puzzles or games. I know we talked about this with our kids and the technology, but really getting our seniors involved with technology, being able to FaceTime with families and seeing a familiar face, being able to talk on the phones, being able to play games, and really help incorporating into that technology. Hospitals are doing better and better with this, but we want to encourage to make sure that they have access to that while they're in the hospital as well.
Well, I think because of COVID, we're going to see some shifts in terms of how we use technology to communicate. And I don't think we're going to go back from
Yeah.
that, because I think we're adapting to this, and it's going to be long enough that it's going to be the norm for us. It's definitely been very helpful, for us, especially like who've had COVID patients who need to see their family
Yes.
members, and you can FaceTime with them. And I constantly think about this, like, holy cow, what if this pandemic was going on 10 years ago?
I
It would be
know.
terrible because we wouldn't have like all the stuff that we have, these virtual
Definitely.
meetings and ways to communicate. So I guess in a sense,
Yeah.
we're lucky to have the pandemic
I know.
now, right?
And it's lonely, and lonely enough if you have to have a surgery or procedure. So I think, or be in the hospital for any reason. I think it's nice to have that technology. I mean, it's nice talking on the phone, but when you can see that little grandchild or your daughter or son or husband, it makes a huge difference.
Yeah, and Dr. Kemp, you've kind of finished up by saying like, hey, make sure you're making room for your passengers, for your family members, and how to involve them with the preparation and then also the healing
Yes.
process.
Yeah, I think it's really, people want to feel helpful. I think sometimes people think, well, I don't want to burden them. But people, when they have purpose and they're caring for somebody they love, it brings a lot of joy to know that they're part of that process. So I encourage everyone, even if it's something little and you don't need your dog fed, give them a job, just let them have some kind of job, make it seem like importance so then they feel important and part of that process. um, you know, maybe fixing something, or could you go get a rug that's non-slip so I can come into the house and not worry about slipping on the new rug. So there's all these little things that you can task family members to do. Filling up your grocery list or your fridge before you come home from the hospital. Um, Doing some laundry, driving you to and from appointments. So you can task a different person with different jobs.
And then also, I think one really important thing that you mentioned, and I love this like so much, was that really designating that one person so that, the nurse isn't talking to 10 people about the same exact thing, right? And the communication between your healthcare team and your family and how to coordinate
I
all
think
of
that's really
that.
important. That really came from COVID too. We used to have visitors kind of pop in all the time pre-COVID, and now you can only have one masked visitor. And we oftentimes, especially at the height of, well, at the start of COVID, I should say, we've kind of are always at the height right now. But in April, May, June, at some point we were allowing no visitors, and now we're back to a visitor. But we had sometimes 5, 10 people calling on behalf of one patient. And what happened is the nurse would get pulled out of the room. They were gowned, they're gloved, they're under a lot of precautions because of COVID. And it was very time consuming for the healthcare team. And we know that it's really valuable and important. And it's really helpful to us to understand the patient and hear from the family. But we don't want to take away from the care aspect. So one family member is great to relay that information, and we want information back towards us. So the more we can take time on the phone to talk to you about your loved one and get information about your loved one, the better care we can provide to your loved one.
Yep. Thank you so much. I think we covered most of these blogs. The only thing that I have to say is what I remember from medical school was one day you and I just stared at a trail of ants in the back. I
Yeah,
don't know
we
if you
did a lot
remember
of
that.
great things. I also remember laying on the beach at lunchtime. So
Oh gosh, I remember that. Those were good days.
they were.
Anyways, I wanted to thank you so much, and I am sure our listeners are going to love looking at the blogs and love this podcast episode. But they can contact you through me by emailing at jerryacademy@gmail.com. And thank you
Absolutely.
so much. Have a great, great rest of your night. And thank you for listening to the
Thank
Jerry
you for having
Academy
me.
podcast. All
Bye-bye.
right. Bye.
Thank you for listening to this episode of the Jerry Academy podcast. Learn more at jerryacademy.com or follow me on social media for information on future episodes.